this morning, Prime Minister Muhyiddin, he announced that he gave a speech in the UN Congress, and he said that if the vaccine appeared available, no one country or no one should be left. But for public, especially I think public Malaysia, I think everyone still hope to know the negotiation details about the vaccine and when possibly the public can get the opportunity to inject.
Thank you. With regards to the vaccine, we are in negotiation with COVAX, for example, with the respective country in China and etc. So the negotiation is ongoing. More importantly is even without the vaccine, we need to comply with our SOP. So I think more importantly is if we can make sure that we can distance ourselves for at least 1 meter, putting on a face mask, hand washing, we can break the transmission about 82 to 85%. So instead of depending on the vaccine, but certainly vaccine is our hope, but today we do not have a phase 3 clinical trials report on the vaccine. So we need to look into the vaccine first, and once the vaccine is available, we need to negotiate in terms of how to procure the vaccine for our population in this country. So this is an ongoing process that we are discussing.
And do you think vaccine is last solution of this pandemic?
No, I don't think so, because even though you have the vaccine, you still need to practice physical distancing. Now, the vaccine means that you are fighting the war in your body. Then you need the vaccine to create the antibody to fight the war. Why not we take the fight outside the body? Physical distancing of 1 meter. That is much better. So you can protect yourself and your family. If you practice good precautionary measures, at least 1 meter, put on a face mask, and then frequent hand washing. So that has been proven to decrease or break the transmission of COVID-19 by 82%. This was published in Lancet. So I think this is, we also have seen when we practice physical distancing, not only COVID infection, measles, chickenpox, hand, foot, mouth disease, all have decreased more than 60%. So that is actually a very positive measures that we can take. And also learning from experience, past experience, although we hope for the vaccine, but we still certainly can do something about it at the moment. From SARS, for example, from MERS-CoV, we do not have vaccine until today, but we managed to eliminate the infection of SARS and MERS-CoV. So if we can do that, I think we need the cooperation from the public as well as from our frontliners, make sure we comply to the SOP, and then we can break the chain on infection in this country. And that's one of the reasons why so far we are doing so well, because of the public health measures. And if you look into our hospital, our capacity is there, but we have we are not using the full capacity. So we have 1,365 ventilators, but we only use 2 ventilators for our patient in the ICU. So we have the capacity. More importantly is the public health measures. We are still able to contain the infection in this country, but if our cases, for example, one day we get 10,000 cases, then it will be difficult for public health to come in to intervene to break the chain of transmission. So we hope that the public and the frontliners will continue to comply to the SOP that's been drafted by Ministry of Health and the government.